Thank you all. Our chair, Professor Josephat Mulimba, the CEO, BioVax, Dr. Michael Luciola, our DG, Professor Mary Gikungu, our CEO, Dr. Peter Midera, all colleagues, and all protocols observed, good morning.
Good morning.
I'm very excited this morning that we are all here. This is a memorable day. It will remain in our memories for longer. Because today we are here to witness a very, very important ceremony whereby we shall be moving our products from the lab actually to manufacturing. I want to thank the team from BioVax for accepting to work with us. I know we started this journey together some time back when we are discussing all these matters, and you promised that you will be here at one time and we shall have an MOU. You know, as researchers, we normally struggle to do research in the lab, come up with new drugs, new vaccines, new diagnostics, but how to move them to the market is the challenge. And today, we are so glad that you are here. You will guide us the journey on how to move everything that we have been doing so that it reaches the Kenyans. And in my view, that is a way to support universal health coverage, which is a very important agenda for the Kenya Kwanza government and the bottom-up economic transformation agenda. The issue is we want to ensure that everybody gets accessible to affordable health care. And we want to do this by moving the products that we have made and BioVax manufacture them so that they are locally made and therefore they become affordable to Kenyans. And in future, we don't know, but if we have the same challenge we had like COVID, and then there is no flights moving, you cannot move from one country to another, then the best way is to invest on your healthcare, because if you don't invest, then you can't go anywhere else. And I think that agenda of the government is a very good agenda, and I'm sure the way we are moving, we are making very important steps. The other way to contribute to the universal health coverage is through prevention, and we do mapping of zoonotic diseases with a view to model and predict pandemics. That is also very important in terms of contribution to the universal health coverage. So I want once more to welcome you to this event. It is going to be, I don't know how to call it, whether it's momentous or exciting, but I can assure you this is really a very, very important event. I know our CEO will make presentations with our remarks concerning the institute, and now I would like to hand over to him so that it takes us through the program and it brings to us the visitors of today. Dr. Peter Midera, our CEO, kindly welcome and bring for us the visitors and guide us through the rest of the program. Thank you.
Thank you very much, CEO. I think I want to start here. The chair, Kenya Institute of Primate Research Board of Directors, Professor Josephat Mulimba, the CEO, BioVax, Dr. Michael Luciola, the DG National Museums of Kenya, Professor Mary Gikungu, our colleagues from BioVax, my colleagues from here, habari zenu. I'm extremely delighted to welcome you to this institution as we chart our journey towards converting our ideas into product and services. There are four things, Chair, that drive the world. It is technology, innovation, manufacturing, and entrepreneurship. And Chair, when I talk about entrepreneurship, I don't mean business, because when Lucille is organizing this forum, somebody saw an opportunity to sell water. That is business. Entrepreneurship is when you see a problem, and then when you are solving that problem, then you create money. So you are solving a problem, but in the process, you are generating money and revenue. In other words, it has an element of impact. But we really appreciate that we are coming to this point where now we can commit on paper on how we are going to engage between the two institutions. When you talk about research, the only way that you can have research being translated is through commercialization. And there is so much that goes on, and you guys know this probably more than I do, that there is so much that goes into research before you can even talk about commercialization. And I want just to share, with your permission, to just summarize it in 3 steps. When you talk about research, you start with R&D. And when you talk about R&D, you're talking about a long investment in terms of time and a very huge financial outlay. And that is where you test, you develop the prototypes or the product that you want to take to the next level. And in the process of doing that, you have to test the efficacy, how effective the product is, and how safe the product is. Within that research and development arena, there is a valley all of us fear. This is a valley we call valley of death. Because many products don't fight their way outside the R&D arena. So that valley of death, we have to find a way of avoiding it. From there, we go, and by the way, when you're talking about R&D, to make one drug to cost you anything about $1 billion. When you're talking about vaccines, you're talking about $2 billion. I'm talking about the traditional ways of making vaccines. Now, with the advent of COVID, we now have a simpler way of doing it through mRNA technology, which I hope we are going to embrace. The second aspect, when we are talking about research, is about commercialization. And to me, this is where we need to emphasize on. Researchers are becoming under a lot of pressure to show their relevance. Because if you cannot solve problems, papers are good, yes, but you have to show the relevance. And that is why if you look at the government programs, the government is emphasizing on output, not outcomes. That you may have your PhD, you have all those papers, but people will ask you, what have you done with those papers? All the program chair that we go, we engage with the government, the emphasis is on the output, not on the outcome. So the BioVax are here because they want to help us to commercialize our ideas into products and services. And to me, this is a very exciting thing because I've gone through that journey and I know how painful it is. You cannot be able to commercialize unless you have an entity. And that is where the issue of partnership comes in. That you need to partner with somebody so that you can take your ideas into the market. The final aspect, Chair, is on the issue of marketing and publicity. And to me, this is one of the most frustrating aspects of science. Because I remember one quote by Bill Gates. He said that if you had only $1 left, he would put that $1 into marketing. In 2013, Chair, I led Kenya into the Africa Union Innovation Award in Brazzaville. And it was a very exciting moment for me because I had won the African Union Innovation Award in the category of the medical products because of some of the products that we developed here. And Kenya was #1 in the entire continent. And the Kenya Defense Forces had developed a very novel mobile kitchen that could be used in combat in the field. And they also won in that category. The veterinary school in Kabete, they won an award in that category because they had developed a digital pen that can connect information with the farmers. And lastly, the Coffee Research Foundation in Ruiro had developed a disease-resistant variety of coffee called Batian. The point is that Kenya was number one. So I want just to give you a snapshot of Kenya Institute of Primate Research. And I'm happy that my sister, the Director General, Professor Gikungu, is here, because when I see her, I feel like a baby, because we are just being weaned off by the National Museums of Kenya. They've really taken care of us, and Prof, please don't kick us out until we are completely ready to leave. And we'll continue working together. So the Kenya Institute of Primate Research, formerly Institute of Primate Research, our mandate is to improve human health, and we do this through research, diagnosis, product development, and training. The institution was established through a legal notice number 273 under the Science, Technology and Innovation Act 28 of 2013. And through the Presidential Executive Order number 1 of 2023, which reorganized the Kenya government, this institution was then placed under the Ministry of Health, State Department for Public Health and Professional Standards. So our mission and vision, first of all, we were established in 1958, so we are actually 65 years old. We are not that young, but we are operating, and we've been operating as a directorate at the National Museums of Kenya. But the initial idea of the institution was to study human evolution. So by 1975, monkeys were identified as key animals in the production of drugs for use by humans and vaccine development. So that is our vision, and that is our mission. So we have utilized biomedical research as the foundation for solving human health, and this addresses the Kenya government agenda on universal health coverage. Specifically, there are 4 pillars of the UHC. And one of them is health technologies and products, and really KIPRE fits into that. So we undertake research that leads to development of vaccines, drugs, therapies, and medical interventions for improved human health. We have also chair and our colleagues from BioVax, we have aligned our research agenda on the Kenya Constitution 2010, Vision 2030, the government 5-year plan that is geared towards Vision 2030, medium-term plan. We are currently on the MTP4, which runs 2023 to 2027. The national government agenda on UHC, the Africa's Agenda 2063, and the SDGs, and especially 3, which is about good health, 5 about gender equality, 9 about innovations, 13 climate action. We plant 20,000 trees within our campuses every year. And Dr. Kivai will tell you that that's something that we religiously do, because 2 days in a year we devote them to that. And one of the reasons why we do this is because our resource are monkeys, and we need to create a habitat for them as we also deal with the issues of the climate. And then 17 SDG on partnerships. And I think you'll appreciate that what we are doing today is part of this. Now, in terms of specialization and capacity, currently, Chair, we have 23 PhD holders. At master's level, we have 22, first degree 47, technologists, technicians, at that level, there are 25. And then we have support staff that total about 33. The research interns keep changing, but I think currently we're about 80 or thereabout. So total, we are in the region of about 230 members of staff. And when you look at the ratio of technical to the support staff is 3.5 to 1, which is a very good ratio. So we have capacity in vaccine development, drug development, reproductive health, disease diagnosis, surveillance, virus research that includes HIV, COVID, dengue. It's one of the hemorrhagic viruses. And then we have a One Health program that looks at the interaction between human, wildlife, livestock, and the environment. And then a very vibrant snake antivenom development. And I think very soon, Dr. George will tell you that we'll probably be the first people who should be shining the first antivenom from this part of the world. And I'm very committed to ensuring that that happens. So in terms of the research areas, we focus on the following areas, and you can see the whole spectrum of our areas of focus in terms of research. Now, these are some of the very new fields that have come into the institution. But what are milestones? And I can just mention a few. That when the COVID pandemic broke out, we were registered by the government to participate in testing for Kenyans so that we could understand and complement the government's effort in terms of knowing to what extent the disease had gone to the community. At the same time, establishing how many people are positive and how many people are negative. And as a research institution, this was good for us because it gave us materials that could enable us to come up with interventions. Dr. Chai is one of the oldest research scientists here. He invented a technique that allows you to access and stabilize the uterus without having to open up the animal. And we decided to honor him by calling that technique Chai technique. This is a very good technique because one of the diseases that we work on here, reproductive health, is called endometriosis. It's a disease that affects about 8% of women that resorts to pelvic pain, resulting to infertility. So we have that technique that is being in use at the institution. We have developed and already commercialized diabeton for management of diabetes. And again, CEO, these are some of the low-hanging fruits that we should be thinking about. We have developed animal models for health research, and these include whole uterine transplant technology. We have also developed and commercialized some of the reproductive health products, including Smoothgel, which is in the market, and SmoothScan. This particular one, and these are the only African-developed products of this nature. The Unipron is a microbicidal contraceptive gel, which you put into the genitals and kills the HIV virus, and also kills the sperm, meaning that it can act as a contraceptive. And what this means is that you'll have a strategy for empowering women sexually so that they can have a product they can use. So this is one product that we would want to do human clinical trials, and I've been hawking for money. Now that BioVax are here, I'm sure something will be coming out of it. We do have, as part of our impact in the field, we have given motorized snakebite ambulances to help the communities in the areas where we have these snakebite programs, including Kitui, Saburu, Baringo, and Bere. And we've also participated in training the healthcare providers in those areas to deal with the issues of snakebite. And then we have breeding programs for monkeys, rodents, rabbits, and snakes for human health research. We have developed we are the ones who developed the National Laboratory Animal Sciences Guidelines to improve animal welfare and ethics. These are very critical to us because in the next slide you'll see that we are one of the few institutions that are ALAC accredited. That's why we have that symbol there. We have mentored and trained over 1,000 local and international health researchers, and we also participate in the conservation of the 450 acres of land that we occupy here. Now, something that I may want to add here is that through Dr. Joseph Kamau, the head of One Health Center, this institution was incorporated in the technical working team or group of the Africa Union on One Health. So Dr. Kamau represents us in that. So already we are being felt within the African Union, and these are some of the things that we really appreciate. In terms of the accreditations and compliance, there is a whole array of it. African Network for Drug Initiative, the KMLTB, we are registered. We are collaborating center with WHO. We are registered by the National Commission for Science and Technology. We are ALAC accredited. We are also registered by the American Office Laboratory Animal Welfare. We are also registered by the Primate Vaccine Evaluation Network in Europe. We have been recognized by the Kenya Veterinary Board, and what that means is that we can offer veterinary curriculum for the veterinary school. Now, we are the first institution in the entire African continent, and I wanted to say that last so that it doesn't escape your mind, that we are the first institution in the entire African continent to be recognized for good financial grant practices. We started with the bronze, now we are on silver, and through Dr. George Omodi, I'm sure we'll be able to reach the gold status. These are our partners and collaborators, and Chair, I don't intend to go through it, but I just to appreciate that it is a whole array of local and international collaborators, and this basically shows you to the extent of impact in our research activities. So in terms of regulatory and safety environment, we have all these committees and bodies that we have constituted or we subscribe to so that we assure that our environment is safe and well regulated. And I think with that, I submit, and I want to thank you very much for listening to me. And at this point now, I would want to humbly request the CEO for BioVax, Dr. Michael Osio, to come and talk to us and take us through what happens at BioVax. Thank
you. Chairman, Institute of Primate Research, DG, CEO, colleagues from the Primate Research, colleagues from BioVax, good morning. Today I'm really honored to be here, having been here before to discuss this, for us, a huge milestone as an institute. So as you know, Kenya BioVax, we were recently incorporated under the Ministry of Health to help to drive the manufacturing and commercialization of human vaccines, in addition to other specialized health products and technologies, including biomedical products like monoclonal antibodies and even antivenoms for snake bites. But today I was reading through the Institute's history, and to just recognize that this institute was established in 1958 was really striking to me. I think we've been here now 2 years as BioVax, so we have a lot to learn from the Institute of Primate Research. And also, secondly, as a biomedical scientist in my past life at AstraZeneca, where we worked very closely with the preclinical department, I see the value that this collaboration between BioVax and the Institute of Primate Research brings into the whole picture around preclinical evaluations. I know how important it is for us to do the safety pharmacology studies, toxicology studies for all the compounds that will eventually turn into finished products. And that's how I see a very strong link between what you do here in primate research, preclinical studies, and what we as manufacturers bring into the picture in terms of commercialization of those research outputs. So for me personally, I'm really honored, and the team from BioVax is equally honored to be in the midst of high caliber researchers who are here to promote health, human health, through the hard work that you do. So we have a short presentation, and I'd like to invite one of my colleagues, Dr. Wanjala, to talk a little bit about BioVax, where we are, and then I can finish off with a few words about where we hope to be and how we see this collaboration working going forward into the future. Thank you.
Good morning. My name is Dr. Cecilia Wanjala. I am a pharmacist by training, and I've been working at Kenya Medical Research Institute. I was involved in the conceptualization and the presentation for us to advocate for local manufacturing of vaccines in this country. And therefore, I'm happy today to be here to witness this happening between KIPRE-BIOVAX and KIPRE. As mentioned by the CEO, we are 2 years old. We were formed through the Companies Act 2015 in September 2021. So we are a state corporation in the Ministry of Health, and our motto is to protect and promote life. Protecting, promoting life from today henceforth. Because we have been relying so much on imports, almost 100% for vaccines, over 70% for other pharmaceuticals. KIPRE-BIOVAX, we are here to ensure that we can do that locally. And as I said earlier, we were established in 2021, and we are owned by the National Treasury. We are a state corporation. These are just details. We have a board of directors and a team of management, and we are currently establishing our staff. So we have onboarded a few staff members. What are our core mandates? Our first mandate is manufacture and commercialize vaccines, therapeutics, and diagnostics. Very important as we sit here today, because we know that through KIPRE we are going to be able to get new products, we'll be able to get diagnostics, and that will help us to achieve our mandate. We're also here to support technology transfer and commercialization of research outputs from research institutions, universities. Again, that is the reason why we are here. For a long time, this country didn't have the platform on which we could push our research findings from the bench to the industry, to the market. And I'm very passionate about commercialization of products. That is what I have done for the last 10 years at KEMRI. And today, KIPRE-BIOVAX, we have an office at Embakasi. We will be seeing it down the presentation, but this really is where we want to go. We want to become a world-class state-of-the-art facility. We want to be of regional importance. We are going to be the regional center, the hub for biomanufacturing, of course with support from our research organizations. We are looking at being able to do over 100 million doses per year of human vaccines, starting probably with the routine and outbreak vaccines. We will be focusing on the public health vaccines. You might be aware that Kenya is soon going to be weaned off from the support from Gavi for our primary immunization program. And that will mean that as a country, we either have to look for a lot of more money, maybe to the tune of excess of 40 billion, to be able to sustain the gains that we have already achieved in our primary immunization program. So KIPRE-BIOVAX is here to stand in that gap. We will also be in future going into the biotherapeutics, insulins, monoclonal antibodies, diagnostics. If you think about insulin, for example, the amount of money this country uses to bring whatever we bring from out there, and even then it is expensive, it is not available for every one of us who might need it. So these are the gaps that we hope to fill in future. We hope, and we're looking to having over 100 highly skilled employees. And in future, we are looking, because we have a mandate to commercialize, to be able to make some profit, over 30%, and eventually we shall be able to earn forex for this country with support from all our research institutions. And I know that there's a lot of research work that goes on in Kenya, and most of it all the time has gone out there to support other companies, multinationals. I think I'll skip this because all of us understand the importance of vaccination. I've already explained the reason and the urgency as to why we need to establish our human local vaccine manufacturing capacity. And it is a very important component also in our primary healthcare programs. And we are looking forward to ensuring also we can be able to respond to pandemics, outbreaks. We learned a lot from COVID-19. And once we establish our local manufacturing capacity, once we have a working relationship with our research institutions, the future pandemic we will be prepared to handle it. We will be looking at the East African regional market. Already we are leaders in the region, and through this manufacturing facility, I think we'll keep our leadership role in the region. These are some of the partners that we have been looking at. We have been working with the Africa Union, the CDC framework, and we know that Africa will need about 23 manufacturing plants in the short term in order to achieve the ambition of manufacturing 60% of its vaccines in the continent by 2040. We want to place KIPRE-BIOVAX as the first among these to achieve the African dream of manufacturing 60% vaccines. There's also a proposal to establish 12 integrated drug substance and fill and finish plants, and also 11 fill and finish plants in Africa. But Kenya, we are starting with the fill and finish, and then we are looking to being able to establish the end-to-end manufacturing capacity, which we can only achieve if we have a stable and a good relationship with our research organization. Again, the reason why we are here today. Kenya, we all know Kenya is the place to be in Africa, and therefore we are looking at using our enabling business environment. We have skilled workforce. I'm sure even in this room we have more than what we need to ensure that this happens. This capability to conduct relevant clinical research and development, as we have heard from the previous presentation. We are a strategic regional hub for commercial and healthy security initiatives. There is a potential market size in East Africa countries with over 150 million doses that are required annually for childhood immunization. And again, we also have a rising birth rate of 2.3% per annum. And we could have, with this, what we are doing in KIPRE-BIOVAX, we could actually avert over 4 million deaths per year. And we could also achieve over 206 million disability-adjusted life years in the region. Talking to sustainability of local manufacturing of vaccines and therapeutics. Viability factors for a long time, and I remember in 2015 trying to present a proposal for biomedical manufacturing in Kenya, and there was this feeling that we can't do it. It's cheaper to import. There's been that talk, but we have looked at the factors, and we know that with the population, the birth rates that we have in this region, and also the ability to work with global players like Gavi, UNICEF, and also the local regional governments, and knowing that we shall be keeping good manufacturing practice at KIPRE-BIOVAX, we want to become world class. We will be able to prove and show that yes, we can do it here, and that those are factors that we have considered seriously, and we know that local manufacturing is viable and will be achieved through collaborations. What are we doing now, or what do we need? What are the areas we have to focus on? The machines and the process equipment. We are cognizant of the fact that vaccine manufacturing requires equipment that is complex and machines that must come in. We are working with that. We are also ensuring that we will have quality frameworks by working with the Pharmacy and Poisons Board and also the WHO and other regulatory authorities. We are also working on technology transfer partnerships with the global players and also with the local players. And finally, we are focusing on human resources capacity building. We know that this has not been happening in the country and in the region, and for us to be able to achieve the level of manufacturing that we aspire, we have to build capacity. And already some of the staff members have been trained, and we continue to subscribe to the training opportunities available. What is happening at KIPRE-BIOVAX today? We have a premise, as I mentioned, in Embakasi. We have refurbished an old warehouse that was given to us. We have offices there, and we have furniture. That's what we have been doing. We are going on tendering process for the machinery and equipment, and also we are discussing with our potential partners on the drug substance to start the fill and finish. When we start fill and finish, and we have also worked to ensure that our institute has been established properly by setting the HR instruments, and therefore we won't have the issues in future about staffing and that we didn't do it right. We have ensured that our HR and organograms are properly done according to the requirements of all the state corporations. And yes, this is BioVax in a very short while. Thank you for listening to me.
Thank you, Dr. Wanjala, for taking us through the BioVax story. And for me, as I said earlier, it's about establishing partnerships, relationships, collaborations, because on our own, we cannot achieve universal health coverage. On our own, we cannot achieve the requirements for local manufacturing. As the President has told us, we have to focus from a health perspective on those two key areas. UHC as a development objective, local manufacturing as an economic pillar for the Kenya Kwanza plan. So with this relationship with the Institute of Primate Research, again, BioVax can benefit immensely. And I think also the Institute will benefit. So it's a win-win situation, win-win relationship that we want to create between BioVax and the Institute of Primate Research. So thank you very much for listening to us. And I'm really looking forward to the next stage. Beyond the MOU, I think we need to plan for the next action, low-hanging fruits, definitive agreements on how to move forward together as partners. Thank you very much.
Thank you very much, CEO and Dr. Wanjala, for that beautiful presentation. It is now my humble duty to invite the chair, the first chair of Kenya Institute of Primate Research Board of Directors, Professor Josephat Mulimba, to come and talk to us. Prof.
The chairman of the board of directors, KIPRE-BIOVAX, so the CEO is with us, and we are happy to have him here. From KIPRE, of course, I'm the only member of the board, but things are changing. Very soon you will be seeing more and more of us. Ladies and gentlemen, I am extremely excited. I think today is a great day for Kenya Institute of Primate Research. I express my enthusiasm for the significant developments taking place at the Kenya Institute of Primate Research, as well as to extend my congratulations to the promising collaboration between KIPRE and KIPRE-BIOVAX. I know both of you are new in your new status, but with this collaboration, I think you will soon look very old and very experienced, and I'm very excited about this, and I hope that this collaboration, this is just the start. Today, indeed, marks a momentous occasion for KIPRE as we solidify this relationship with the KIPRE-BIOVAX Institute, While KIPRE is yet to be fully operationalized, I am pleased to note that we have got Professor Kinywa, who has already been gazetted as one of the members of the board, and I'm hoping that before the end of this month, we will be fully constituted so that we can actually be able to start actually putting the institute in its proper place. At the moment, we have very many vacancies and very many shortcomings, as you can actually see. Yeah. In fact, I'm sometimes ashamed when I see our very able CEO having to put AG in front of his name. But once we are actually fully constituted, most of these things will be corrected and we will actually be moving forward. And I am optimistic that actually this will happen before the end of this month, because we are pushing for it. In the interim, KIPRE is actively engaged in preparing essential human resource instruments, including the organizational structure, career guidelines, job description, staff establishment, in a strict adherence to the laws of this country. We can't do anything outside that. So their proactive approach ensures that KIPRE is well prepared for the transition from the museums to the Ministry of Health, where we have actually moved from. Furthermore, KIPRE's commitment to cutting-edge research and innovation is commendable. The work being done on processing an antivenom for use in Kenya and our region is particularly noteworthy. And this is a thing that actually we should really work hard on, because as you have been told, the government will give us money to a certain extent. But if they see that we are not bringing profit, then you find that actually money starts to dwindle. But if we develop this antivenom, which I'm quite sure that with the collaboration with the BioVax, we are going actually to be able to do so very soon. We will actually find that actually we are getting far and a lot of attention from other quarters. This development holds the promise of providing much needed relief to the people living in areas where snake bites are common. And these areas such as Samburu, Kitui, Baringo, Mbeere, Turkana, and Coast region. We look forward to KIPRE and BioVax collaboration through the proposed MOU. I commit to preserve the confidentiality of information, documents, or data received for the purpose of implementing this MOU, because this is a crucial element in building a strong partnership. I would like to convey my best wishes for success to both institutions, and please consider my unwavering support where it may be needed, because this is the only way KIPRE will convert its research into products and services for the benefit of our people. And I think this last statement is the most important part of what is going on today. You can do wonderful research, and I think our CEO has alluded to this, and Dr. Wanjala has also said something about this. You can do wonderful research, but if you do it and you leave it in papers and you put it on in shelves, it means nothing. The research is actually only useful when it is converted into practical benefits to the population within where it is being done and the world at large. You may import the vaccine cheaply, and this actually can happen very easily. And then you say that you are not going to manufacture yours because what is coming from outside is cheap. But those of you who remember what happened with COVID, that when COVID actually was at its height, people were manufacturing vaccines in their place. But what did they do? They said their population must be certified first before you give to the poor Africans in sub-Saharan Africa. So it may be cheap, but it may not be available to you. But what you produce yourself, you will make sure that actually your population is actually well looked after. And that's why I am very keen to see that actually this partnership is translated into practical products that we can actually be able to utilize. So, Dr. Wanjala, you have to work harder and make sure that we actually get products. The other thing that you should watch against, I know that we in Kenya, sometimes we are over proud. We go and say, now we are number one on this one, we are number one on that, and then we take life easy and we start going down. Keep your vigilance. Keep just improving and improving. We have no room for laxity. Don't say that actually we are number one in East Africa, so we are okay. We are not. That, as the CEO said, what you are doing well, you can also do it better. So let us actually have that aim. And with that, I would very much like to welcome the MOU between KIPRE and BIOVAX. Thank you very much.
Thank you very much, Chair. We can do a better clap. Thank you. So I now want to return the mic to the MC.
Yeah, thank you very much. I think it has been a wonderful session, isn't it? Yeah, let's appreciate them once again. I think the long-awaited ceremony has come, and the ceremony starts now. So I want to call upon the PR team. I just want to see the PR team so that now we start thinking about the ceremony.
Our board chair, Professor Mulimba, Director BIOVAX, Dr. Luciola, our director, and our visitors, my colleagues, good morning. Our visitors, please feel welcome to KIPRE. We are warm people. We are happy to have you here. And we are really excited that we have this MOU, because as everyone who has spoken here said, it's going to bring our work to the light, and it's good for the country and for us all. So now we have one document, but 4 copies. So you will sign 4 times. Your institution, BIOVAX will take 2. That one will stay in the CEO's office, and the other one in legal office, and same with KIPRE. So it's as simple as that. So you sign where your name is, and you will have a witness. And if you have your company stamp, you stamp it there.
So, HODs who are present, HODs present, and the BIOVAX team, we shall stand at the back so that we are featured. Tafadhali, mfanya haraka, HODs present and the BIOVAX team, let's witness the signing at the closer range.
All right, congratulations. So this MOU was done by a competent lawyer in consultation with the CEOs. What they have done is they have signed the MOU and put their signatures on every page. So it's a very valid document. So we kindly ask you to hold the documents so that we can have a photo. Each of you holding the documents, showing to the cameraman. Yes, that way. Clap again, you can stand up. It's a celebration.
Yeah, I think now is shaking hands and exchanging the documents. Yeah.
Sorry, shaking hands and exchanging the documents. This is the CEOs. Look at the camera.
Look at the camera.